Good morning, everyone, and welcome again to another Hot and Health Topics with Dr. Q. Hello, Dr. Question. How are you?
Hello, Neil. Good morning. Thanks for having me again. I appreciate it.
Good morning. I see we have another furry friend with us. Is Treasure going to be joining us for today's discussion?
Yeah, so Treasure's hiding here under my hair. Maybe you can see him. But then we have Bob, the cat, who's been in many, many videos and has actually flown around the country to be in videos. So he's sort of thinks he's famous. But so he's going to be demonstrating for us a couple of things today during our discussion time.
Yay! So, today's discussion for February 2nd, we had a lot of questions recently in positive pet advice. And for those of you that don't know, Dr. Q and I, we admin a group on Facebook called Positive Pet Advice, and we're averaging almost 7,000 members right now who are extremely active and love to ask questions. And honestly, we just want to give our feedback. So today, we wanted to talk about why does my cat all of a sudden poop outside of the box? And some canine oral care and maintenance suggestions. So we're back, Dr. Keel. Cats pooping outside the box. What do you think about that? They go in the box all of a sudden and now they just don't want to go in their litter pan. Why could that be?
Well, Neil, there's lots of reasons. It can be behavioral, it can be medical. We actually just had a case like this come to the hospital not that long ago, and this kitty cat had suddenly started peeing outside the box. And of course, that can be very frustrating. So these owners actually wanted to put her to sleep for that because they were so intimidated by how expensive it was going to be and how difficult it might be if she were to have a urinary tract infection and what it would take to get that cleared up.
Right.
But luckily, the clinic and we stepped in and we volunteered some time and services and medications to them to just treat the cat for urinary tract infection, because I really think she'll be fine if we just get some antibiotics into her and figure out what is causing her infection and get that cleared up. So
Right.
I would say, of course, that's the first thing. It makes a difference if they're peeing outside the box versus pooping outside the box versus both. Okay, so those two things can make a difference. And then the other thing is making sure there's not a medical cause for that. A urinary tract infection, constipation, having trouble going to the bathroom can also cause cats to do that. But once you've gone to the vet and you've decided, okay, there's no urinary tract infection, everything is going good with digestion. So unfortunately, it comes down to behavior. That's when it's helpful to have somebody like you with your expertise in the things that make an animal's mind tick and help figure out what it is that could be causing them to be trying to communicate something with us.
Right, right. So in your behavioral capacity, what are some of the things you would think that could possibly be causing that?
Yeah, very good question. So, being in a multi-cat household where one cat is being intimidated or bullied by another cat can definitely make the litter box suddenly very unattractive place. If
Okay.
it's like around the corner and down the hall and in the bathroom, and you have a cat like Bob here who likes to stalk my other cat who is less than half his size and try to intimidate and catch her and scare her because he thinks it's great fun. She, of course, does not think it's so fun. So I don't have problems with her, though, because we've done other management things
Right.
to minimize that from happening. But that is definitely one thing. Changes in the household, construction, marriage, children, things like that can cause a lot of stress. And then, animals only have a certain amount of ways they can communicate with us, and certainly not with words. So it's just with their actions. And so their actions really speak louder than words and tell us that if they're going outside the box, something is wrong, something
Right.
is stressing them. And we have to see. I mean, maybe you live in the country and there's a coyote that's coming up onto your back deck during the day while you're at work that's intimidating and threatening your cat through the windows. I mean,
Right.
that happens up where I live. And so, you have to really think outside the box about all the things that could possibly be from, neighbors and pets and smells that you may not be able to even smell or see, because keep in mind, their sense of smell is so much better than ours.
Right, right. Well, that's really funny that you said to think outside of the box. I think that's the biggest, I think that's the biggest pun of the day, but it's so honest, is that if we do have something that is concerning us, automatically go to your veterinarian first. We want to make sure that there's not a health risk that's causing a sudden behavior change. But
Exactly.
then, if your cat is pooping outside the box, in this case, let's think outside the box. Is there something going on at home? Is there a change in the family dynamic? Is there a recent move? Does the new neighbor have a dog? Or anything in their environment that has changed could ultimately change their elimination schedules, or lack thereof, in my case. So, but we see this a lot of times too. I know we've discussed about house training dogs and things in the past. Sometimes we have to take those exact same things into perspective and figure out it could be behavioral due to just regular environment and dynamics. So great. Thank you so much, Dr. Q. That absolutely amazing, and you made me think, which that's awesome too. That's the best part of our discussions.
One more thing I want to say about that, Neil,
Go for it.
is we also have to keep in mind that different cats do have preferences for different kinds of boxes, different kinds of litter. So we have to take into account the emotional piece, but also like the physical piece of the potty area for a cat. Some litters that have a lot of scent can really put a cat off, and so that may be something that's going on. It could be the texture that they don't like it. It could be that it's too dusty. The clinic that I work at, we actually don't recommend clay litter, because the doctor has seen where cats will walk in the clay litter and then lick their paws and then get a belly full of clay over time.
Yeah.
And yeah, so there could be, things like that to think about. Also, I don't use traditional litter boxes. I use a big sort of storage bin that you would have like in a closet that's just about this tall and this big, so that it's totally big and open, full of sand that they can dig in. So that makes them kind of have a good time, kind of makes them think they're maybe outside. And then, of course, always have at least one more box than you have cats. So if you have 2 cats, at least 3 boxes. I have more than that, because it just makes life easier, and I keep them fastidiously clean, because you wouldn't want to poop in a dirty toilet, and neither do they. So we have to be keeping that area very, very clean, and then that really helps minimize problems as well.
Oh, that's actually wonderful. I never even thought about more litter boxes than cats. I don't even think I've heard this, why is it so many more boxes to cats? That's very interesting to me.
Yeah, because it's a resource issue, Neil.
Okay.
It's just really very simple. It's just a resource. So if you have more, then they become less high value, and then less high impact for clashing when you have multiple cats.
Right.
So that nobody can, so I think it makes sense from a behavior point of view.
That's completely new to me. Thank you. I learned 2 things in one day. Oh my goodness, Doc, you're on fire today. So before we jump into the next topic, I was wondering if you would give us just a brief, how do you get started with oral care and maintenance? No matter what the species, we all have to start in the same place. Would you be willing to give us just a quick why you brush teeth, how you get started, some other things we can do to keep fresh breath no matter if it's our cat or our dog? What are some of your suggestions on getting started in that?
Well, It's so important, and I'm so glad you brought it up. This is like my favorite topic, really, of
I
all time.
know. That's why I've been dying to do this video with you.
Let's talk about teeth. The reason I think it's so important to talk about teeth is because if we could get every pet parent in the world on board with being more in control of their pet's oral health, oh my gosh, all these animals would live longer. You'd save so much money. It's in with so much hassle. I mean, you have no idea. It's like this huge payoff out there for anybody that loves animals to invest in taking the time to take care of their teeth. So that's why I just think it's so important. And so, of course, starting with kittens and puppies is helpful, when they're small, and then making it short sessions and as fun as possible. And the other thing that I do is I sort of play this push me, pull you game with my cats.
Okay.
This cat in particular, which is sometimes how when your dog or your cat is hungry and they're coming to you and they're like pushing against you and nudging your arm and you're just trying to finish this email or just trying to finish that phone call before you can go get their food. And just like him, see, he's demonstrating.
Yeah, you can't see it right now, but I actually have Loki in my lap. And so his head is in this entire shot right now. Because
You know what I mean?
it's the, yeah, you kind of have to set a little bit of, a pace for them. I find that if I encourage him to, let's get up close and personal, when it's time for me to get up close and personal, he's all about it, because he's like, oh, this is allowed, this is fun. Absolutely. You definitely need to make sure that you can touch them all over the place. You can, and then you reward them for it too. Like, as right now, I'm not clicking, but I'm feeding hot dogs like it's nobody's business. I wouldn't be the treat fairy if I wasn't doing it that way. But the thing is we're trying to create that, just the space to where we can then manage the teeth and do everything that we need to do. And there's an acceptance to it. I mean, it's a little weird, like, why are you rolling around in my mouth right now? But it's we're doing it for your well-being. I personally, I have a dog who, his teeth, I've showed you pictures of my dog's teeth, Doc. They are horrendous. But I got him that way, so everything that's happening to them now is just me trying to make sure that they last as long as in his head as physically possible at this point. So I have to keep them clean, and I scale, myself. I know it's not something that's generally recommended, that we're gonna, tell all of our clients, oh, go scale your dog's teeth. But, if it's something that's within your capacity, then by all means, it can save you from some anesthesia. It can save you from a pretty expensive procedure, to put it bluntly. So do you think that there's a difference in the way that we should do this between cats and dogs, or do you think we should be treating them the same push and return, that little bit of reciprocation? Is this ultimately what we're kind of looking for?
Yeah, Neil, I think that it's such a good question. And so, as far as people like hand scaling, like you're mentioning, so I would say that that's sort of for the more advanced people, maybe who your veterinarian has had.
I don't recommend it at all. But I do it because I can. But that's the difference.
And the reality is, you're probably not the only one. There's probably other people that are doing it. And I think that if you can brush your pet's teeth, then you can probably not hurt anything with the scaler. But my recommendation would definitely be, first, for anybody out there, just be able to brush their teeth on both sides, and then talk to your vet before you ever put anything metal in their mouth, and see what your vet has to say. But to get started, if you don't have a puppy or a kitten, or even if you do, you can still train adult animals like this kitty cat here to tolerate it. And the way you do it is what I do is I wait until, one thing, I never use restraint. Okay. And I think
Right.
that's really important. Never use restraint. And I know that sounds really crazy, because people expect to, okay, get the towel and wrap the cat and hold the dog down and get the stuff.
Everything needs to be a burrito, and it really
Yes.
doesn't.
Yeah, and go get the stuff, and we just have to not approach it like that ever. And how we have to approach it is if they're laying quietly, they're laying our head in our lap. And then we can start to gently sort of explore, carefully rubbing our finger on the gum line, and just start
Right.
with that. And just get them sort of accustomed to gently touching them all around inside the mouth. And I'm going to demonstrate on Bob right here, if you can see me. And so basically, so he's not tied up. We're not doing anything. He's free to go at any time. So I'm going to pet his head with one hand, pet his head with the other hand. He's still fine. He's not running away. He doesn't mind me doing this. He's not pulling back. So then what I'm going to do is hold his head and pull his gums back, just like that. And he's pushing against me with with a 1 out of 10, with 1 being barely any pressure and 10 being as much pressure as he could possibly do to draw blood. He's probably touching me with a 2 or a 3. It's just a very gentle sort of, hey, really not a fan. And I can be respectful of that. And so I stop. And if you'll notice, how you can tell if you're doing it right is if they're still here when you're done. That's how you know if you're doing it right or not. And so he may not be able to see him, but he is right here. So he came, he didn't feel any threat or any fear or anger or anything. In fact, it didn't do anything to hurt the bond that I have with this cat, but actually did something to increase that bond. And here he is, just in such a good spot. I'm going to show you again. And there's his teeth right there. And again, he's pushing me again with like a 2, and so I just go, oh, okay, just like your friend. Okay, if you're having a conversation with a blind friend, say, and you're trying to navigate something, how are you going to navigate it? You're going to navigate it through like body pressure, steady their hand to navigate this. And so you're just navigating it with your animal in a way that's safe and comfortable for both of you.
Now, I just want to point out, too, that, in reference to your friend, don't pick your friend's teeth for them. I mean, you can point it out, but don't go, like, trolling around inside your friend's mouth or their nose or any... I mean, we learned that when we were kids. You can pick your friends, but you can't pick your friend's nose, right? Don't go out and pick your friend's teeth. However, understand that you should be able to have a relationship with your friend to where you can say, got a little something right there, right? So what we need to do is be nice and courteous and say, hey, you have something in your teeth, and then allow them to pick it out. But in this case, the cat can't pick it out, but we want to tell them, then we want to approach them, and then we want to follow through. We want to keep it kind. We don't want to just force all of this around. And Doc, it's really great. Unfortunately, you don't get to see me, but Loki was up here. I did a cute little demo while I was talking, and the fun part is while you were doing with your demo with Bob, Loki was still right on my lap. There was no connection loss. There was no friendship loss. There was no hard feelings. He got his hot dogs. He was perfectly fine with it. Make sure you can create the bond first before you just try to heave on in there and take care of business. I think that would probably be the message from today. Now, when it comes to oral hygiene, I know it's one of your favorite topics. Do you have... Now, actually, this morning I found a recipe for homemade dog toothpaste, so I'm going to send that over to you to get your opinion on it before I post it. However, do you have, products that you like to use? Do you have ones that are your go-to recommendations for oral care, maintenance, hygiene?
Yeah, there's one particular dog treat that I really like, okay, and it's called a veggie dent, and that's VEGIDENT. And no, I am not compensated in any way for endorsing that one, but I just really like it. It's made by a company called CET, and they're veterinary dentist approved products, and so there's actually been tests done that show that if you feed your dog one of these treats every day, they'll have less tartar on their teeth after a month or whatever the case may be. So I like those. But really, I think almost anything that's out there helps. I don't think there's anything out there that is going to make your dog or your cat's breath or dental disease worse. So,
Hopefully.
Yeah, I don't think so. So, I mean, I think the water additives have been shown in trials to be effective.
Correct.
I have not done them because I have so many animals, and it just wasn't a good fit for me and my household. But I've heard good things about those, and veterinary dentists recommend them. I also know that veterinary dentists will tell you that you should never feed your dog anything harder than your dog's teeth. Okay, so they don't like dogs to eat bones really of any kind because they're seeing broken teeth and doing caps on teeth and crowns on teeth. And so a lot of us do that anyway or inadvertently because it's an inexpensive way to exercise your dog's jaw and need to chew. Just relaying the information more than anything. I mean, sometimes people get away with it for a long time and never have a problem. And then one time their dog does break a tooth or something. And so that's unfortunate. What else? As far as products, I just really like anything that's been approved by the Veterinary Dental Association. I mean, that's really, I think the big thing is, we have people out there that are evaluating these products to help us to know that what we're buying is actually going to do what it says it's going to do. And so if we can get stuff that's been approved, then that goes a long way to making sure we're not wasting our money.
Yeah, absolutely. It's really funny. I used to go out and get the craziest things the most aggressive chewers could never destroy because my old lady, well, she has no teeth left anymore because she's worn them down so much through the years. But she's such an aggressive chewer. Thankfully, she's never cracked anything. She's never broken anything. But her teeth were always clean. They were always, vibrant. They were always bright. We always got compliments on how nice her teeth were. And I was like, I never had to do a damn thing. Now I have the dog who, well, let's face it, he's going to need a lot of work for the rest of his life. It's really entertaining now that I'm starting to explore different toys that are good for chewers, but not necessarily degrading to the tooth itself. And so I'm starting to find a lot of the Nylabone products they're actually coming out with more durable, Nylabone. We assume they're rubber. I've never really looked at the package. However, oops. But I'm noticing that it's something that he appreciates a little bit more. There's a little bit more bounce to it. There's a little bit more give to it. And some of these things we might have to start thinking about if we have a dog that might have some dental conditions to where we might want to manage their toys a little bit more. I just now have a dog, he just now wants to play with a tennis ball after almost 2.5 years. He never wanted to because he didn't like to chew things. He didn't like to put things in his mouth. I'm assuming because it hurt. I'm assuming because there was some sort of there was something telling him, no, I can't do this. So now we're just now getting into it, but it's all been because of care and maintenance of those teeth. And I'm now starting to see him interacting with balls and bones and toys, and it's kind of interesting. Don't know if it's related, but it's one of those, it could totally be. And you have to think outside the box and wonder if some of the things that's happening behaviorally in that animal could be because of its surroundings or its physical body. It's that physical medical concern, which we may not know about. We might have to do some blood tests. We might have to do some urine analysis. We might have to do biopsies. We don't know what the problem is going to be unless we look. So could it be behavioral? Yes. Could it be medical? Absolutely. So if there's anything you guys are going to take from today, I'm going to go with Dr. Q on this one. Think outside the box. Look at some of the different things that are going on in your house. It could be, it could be the concern you're looking at. And then oral care and maintenance, get started with it. When they're young, start them out. If you have an adult dog, start at the beginning. Even though they're not a puppy, start at the beginning. Start to interact with them. Start to touch those paws. Oh, I see. There he is. There's Treasure. The adorable thing. Bearded dragon totally just came into screen, and I completely.
I don't brush his teeth though. I'll have to.
Is it you or is it him?
I'm not sure. Maybe some reptile people can weigh in, and if I should be, I don't know.
Should you be brushing your reptile's teeth?
I don't know. Let's start a conversation about that.
I totally think that is a perfect way to end. We're hitting 25 minutes, Dr. Q. I love sitting down with you. I love being able to do these live broadcasts. I need to thank you oh so much for having us on your live stream today, Dr. Q. And for those of you that don't know, go ahead over, subscribe to Dr. Q for some more info. We'll be bringing you guys some more live feeds, some more other videos, podcasts, everything coming down the line at Dr. Question. I am Neil Hutchins, your treat fairy.
Thank you, Neil.
You're very welcome. Thank
Everybody
you.
out there, check out the Treat Fairy. He's a wonderful, wonderful service dog trainer. So if you need any resources there, Neil is your go-to person on that.
Thank you.
I'm Dr. Q, the life coach for people with pets. Subscribe to my YouTube channel, The One Dr. Q, and tune in. We'll see you right here next week. Bye-bye.
Bye.